Good morning. Welcome. My name is Elaprolu. I'm part of AWS public sector team, and I'm responsible for our IoT activities across public sector business worldwide. So what I'm going to be talking about today, thankfully I'm not going to be talking for long, probably spend about 10 minutes or so talking about IoT, cloud technology, and how it's enabling innovation and actually helping save lives around the world. And I have a guest speaker, Dr. Martin Lukac, who's the CTO for Nexleaf Analytics, a customer of AWS that are using IoT technology and data analytics to do some really amazing things. So he's going to be talking for about 20 minutes or so, and then we'll open up for any Q&A after that. So whether you are in the private sector, public sector, or in the charity and not-for-profit space, imagine if you have the ability to have access to data, all of the data that's impacting your operations, whether it's commercial operations, your business operations, and so on, and having access to that data real time so that you are able to change and influence the decision-making process that you have in place in order to improve your operations. That's really what IoT, the field of IoT and the technology of IoT along with data analytics enables you to do. And that's an area where we're seeing some interesting, innovative solutions coming to forefront, both across the public and private sector space. Now, because of that potential, we're also seeing organizations, both commercial and public sector, adopt more and more IoT deployments. They're doing a lot more IoT deployments, and the pace at which they're doing is growing very rapidly. There are some estimates that by 2020, there will be about 20 billion devices. These are things, sensors, Raspberry Pis, and so on and so forth, that will be online and collecting data and transmitting that data. There are some estimates as high as 200 billion. No one knows for sure what the number is, what the final number will be. It doesn't matter. It's going to be big. The reason why it's big is because the potential that it has to influence what's happening and allow you to make important decisions in your operations. We're already seeing organizations do a lot of this. And these examples of what they're doing with IoT, just to give you an idea, these are some areas that customers are innovating on. Predictive maintenance, industrial IoT, anything that has potential to influence how you create products, how you operate those products is a huge space for private sector industry. In the public sector space, we're seeing very interesting solutions come up in the transportation space, whether it's on land, in the air, water-based, and so on. Public safety solutions, whether it's solutions like flood detection, being able to detect any type of disease outbreaks using sensor technology out in the field. Public health is another area that we're seeing some interesting innovations happening in this space. And the last is you probably are familiar with this notion of smart cities, smart buildings, smart communities, smart states, and so on and so forth. All of these, once again, using sensors to collect data, analyze that data real time, use that information that you're gathering from that analysis in order to improve your operations. There are two main reasons why customers think about IoT, irrespective of whether, once again, you're in the private or public sector or charity and not-for-profit space. The first one is you're trying to improve your cost model. You're trying to either, if you're in the private sector space, you're trying to improve your revenue growth. You're trying to come up with new products and new ways of solving problems so that you can improve your revenue. If you're in the mission-oriented space, you're trying to optimize your spend so that you can stretch it a lot longer and much further to do more for the mission. The second area is operational efficiencies. This is where systems and solutions have already been deployed. Wouldn't it be great if I can use data to understand what's happening and optimize the operations? So once again, I can do much better, more efficiently, and at a lower cost, and much better return for that same spend and the solution that's already deployed. One thing for sure, IoT solutions are not easy. They are, in fact, can get quite complex. And there are a number of reasons why they're complex. There are examples being, when you talk about sensors and devices, that's a whole new space that a lot of the companies and organizations are not familiar with. So how do you go about deciding what kind of sensors and devices do you bring on board? Second, once you decide, for some way decide what you're going to bring on board, how do you then connect that data? How do you connect that to a cloud-based system or an on-premise system? How do you process that data? What kind of applications and solutions are going to build on top of the data? And then eventually, last point there is really interesting in the sense that once you start automation, there is a shift in not just technology, but also people processes that is going to happen. And that's an interesting area where there is some level of resistance from potentially employees, operational staff, where you need to take that into account. So when you think about IoT solutions, technology is one area, but there's also a cultural shift that needs to happen. Taking into some of those challenges into account, AWS about 2.5 years ago released a complete suite of products. I won't go into a lot of detail here, but a complete suite of products allowing customers to focus on their mission, their solution, and not as much on the underlying technology space. Instead, take that undifferentiated heavy lifting away from you so you can focus on the mission and create those innovative solutions for your business, and let AWS deal with some of the underlying muck that needs to happen for those solutions to operate at scale and cost effectively and securely. And there are two main areas that those services get broken down into. There are a number of services in the cloud space, and then there are services, especially with IoT, terms like edge computing, microcontrollers, et cetera, that need to be connected up so that you get a lot of that data that you want to analyze. So wide range of service capabilities that are available. And with those services, we're seeing some really interesting innovation happening across the spectrum. These are some examples of customers. I'll touch on some of these use cases really briefly. Just to give you an idea, BMW, for example, their 7 Series sedans are now connected where data from the cars, real time, is moving up to the cloud, data about road slipping conditions, moisture level conditions, and so on and so forth, so that that data gets sent to the cloud, gets analyzed real time, and that data then gets transmitted down to the in-car navigation system so that you get advanced alerts of any slippery conditions that may be a mile or two ahead where you're driving based on other BMWs that may have passed on that road in the near time frame. Or looking at Philips on their healthcare division, where all of their high-end, expensive medical imaging equipment and medical devices are now connected so that Philips is able to understand from a maintenance point of view how this machinery is working. Because imagine if one of these machines breaks down, and if it's in a remote location of the world, it's a huge challenge, both for Philips as a company, but also for the customers, more importantly, for the hospital systems and so on, where it's out of service. So being able to use data that's coming off of the operational status of the machine, analyzing it and understanding and starting to predict when failures are likely to happen is a huge asset. Some real quick examples. I know some of these are more private sector specific, but just to give you an idea of what customers are doing. Wärtsilä is a marine engine manufacturing company out of Europe. Their engines, about 35,000 of them, are deployed in 14,000 ships. So these are cruise ships. These are cargo carriers across the globe. So what they're doing is using sensors on those engines to understand the engine behavior, streaming that, processing that to start predicting when these engines are likely to break down, so that they can actually take care of those engines before they break down. Imagine if a ship carrying goods or perhaps people breaks down in the middle of the ocean. That's not a good day. So what Wärtsilä is trying to do is to prevent that kind of a situation from happening and lower the cost of those maintenance challenges that arise as a part of the breakdown. Or looking at iRobot, their Roomba 3, the latest version of vacuum cleaner, is now connected and powered by AWS IoT so that they're able to understand how those machines are operating. Any type of updates or patching that needs to happen can be done remotely, even long after the customer has bought the product and went home and plugged it in and start using it. So they can remotely update, they can remotely patch. They can also add additional features as and when needed. So lots of potential for iRobot. Or if you look at the city space, MyVision is a company based out of Canada that's doing some really interesting and innovative smart traffic intersections, understanding traffic flow, understanding pedestrian counts, understanding accident rates and likelihood, using sensors to collect all of that data, transmit that real time into the cloud, process it, and depending on what the local Department of Transportation wants to do, they can even adapt the lighting controls so that if on a particular day, let's say due to weather conditions, a traffic flow is choked on a particular part of the city, they can adjust the lighting controls so that perhaps green stays a little longer, extra minute or half longer, so that you can relieve that choke throughout in a completely autonomous way. Or Stanley Black & Decker, which is more of the consumer side of it, using sensors and data that's collected off of the machinery that's in people's hands to understand what features of those products are actually being used. Therefore, they can actually improve and add more capabilities into those, versus the features that Black & Decker engineering team thought were really awesome that no one cared about, and start removing them, and also understanding which features are actually breaking down more often versus less. Next one is an interesting one in that this is in the not-for-profit space. This is actually a solution out of Indonesia called Pita Bencana. It's a not-for-profit entity funded by grants from Twitter, USAID, and a few other not-for-profit charity organizations that are supporting this, including MIT. The idea here is, what you're seeing on screen is actually one of the city centers in Jakarta, Indonesia. For those of you that are familiar, Southeast Asia, during monsoon season, flooding is very, very common. Not a lot that cities can do to prevent that from happening. However, the likelihood of loss of life is immense. So what the team here decided to do is deploy some sensors around the city, lake, riverbeds, water streams, etc., understand the water level rise and drop, real time, stream that into the cloud. Second, they're taking data from social media that maybe people are talking about potential flooding conditions, potential issues that are starting to happen on streets and other parts of the city. Collect that into the cloud, bring that into the cloud as well. Look at weather forecasts that are coming in from meteorological departments. Combine all of this data and apply machine learning model on top of the data to start predicting, not just reacting to where the flooding is happening, but actually predict where flooding is likely to happen in the next day or less. And then take all of this information, alert citizens in the appropriate neighborhoods, send that data and make that available to first responders and emergency response teams within the city. Huge benefits that cities are seeing, where for the cost that's being spent to deploy such a solution, immense return. In fact, the solution is so successful that it has been expanded to multiple cities in Indonesia, expanding to India, and recently into Florida as well. Next one is from Emory University. This is around healthcare research. This is a project that's trying to understand, this is a long-term project, potentially 10 plus years, trying to understand the human aging process and what environmental factors and how those environmental factors will influence your aging process. For example, if I exercise regularly, what does that mean for my aging process versus if I don't? If I eat healthy versus if I don't? If I smoke versus not? So taking all of those factors and doing so using sensors behind the scenes so that I don't, as a human, don't have to go in and enter this detail myself. So collecting all of that information, applying machine learning on top of the data, and understanding how that human aging process will proceed. This is an interesting one in that this is, once again, a charity out of UK called eWater. The idea here is that drinking water in some parts of the African subcontinent is not available, or is available but is not easily accessible. A lot of wastage happens, and it's not, if you're in a remote location, if you lose that tank or 2 tanks worth of safe drinking water that's made available, and you have to wait for the next day for those tanks to come in, that's not a good situation. So what eWater decided to do is use sensor technology, deploy those in those taps that are controlled remotely through sensors, and each authorized person in a family is provided a small token, like for example, the token that you're seeing on the screen there, and as they go in and tap using NFC technology to one of those taps, it knows who that person is based on the token, it knows what their usage history is over the period of time, and then automatically activates the tap for a period of time. So they can get their water for the day, and as soon as that time elapses, it closes down. So once again, goal being that bring about responsible use patterns by using technology in the meantime. This is also a flood detection solution, but this one is out of Cambodia. Once again, USAID funded and not completely charity-oriented project, deployed and already has saved significant number of lives in Cambodia. And the last example is, this is an interesting area that we're starting to see more and more starting to happen in Latin America, in Africa, in India, and other parts of the globe where agriculture is a big part of the economy. Using sensors to understand what the crop conditions are, when do you plant, when do you water, what kind of fertilizers do you use, how often, how much, all of that, so that you don't need to be an expert at doing all of this. Instead, those sensors will actually start calculating this information, feeding it into the cloud, get the industry's best experts providing those models so that you, as a farmer in the remote part of the world, are leveraging the best minds that have created those models for you and get that output so that your yield is improved in a substantial way. So just thought I'll pause here. I'll invite Dr. Martin to come up here. But think about all of the possibilities that IoT opens up and the analytics. It's not just IoT, it's the data that's coming in from sensors, but the analytics that you're about to apply on top of it, and all of the interesting things and problems that you can solve. So I'm going to invite Dr. Martin to come up here. As I mentioned previously, he's the CTO for Nexleaf Analytics. Very interesting use cases and problems that they're solving using cloud technology. Thank you.
Thank you, Sri. Hi, everyone. I'm Martin Lukac. I'm the CTO and co-founder of Nexleaf Analytics. We're a company that builds sensor technologies, IoT systems, and data analytics to work on improving human and planetary health. So I'm really honored to be here. Thank you, Sri, for inviting me, and AWS for having me come here and talk. I'm really excited to tell you about our work. And I'm cramming a lot. I'm normally used to giving like 10-minute talks, and I have 20 minutes, so I'm putting in a lot more, but I'm probably going to miss things. So I would love to hear from you afterwards and chat with you about this, and also hear about, like Sri was asking, what are the ways you guys are using data and trying to get data to connecting data to impact. So I'm going to cover two problems, or two of the problem areas we work on. So for the first one, imagine that instead of waking up in your comfortable bed, you wake up in a thatched mud hut in rural India. And instead of going to your kitchen to make some coffee or tea, you leave your hut, you go out of the village, across some fields, into the forest to collect wood. You bundle up the wood, carry it on your back or your head, and take it back to your home, where you use the wood to light a fire. As the fire starts and continues, there's a lot of smoke, a lot of particulates, and a lot of soot that comes out of it. It makes your eyes tear, and you realize that you're breathing all this stuff in. So I wish this was, and you're doing this because you want to nourish your family. You're cooking meals for your family. And I wish this was an extreme example, and I wish it was something like one of those relic of the past things, but it's not. Every day, 3 billion people cook by lighting a fire, often indoors. Not only is it really labor intensive, collecting, chopping, and building the fire, but it also has major environmental and health impacts. On the environmental side, there's obviously the CO2, but there's also a subset of all that soot and that smoke. It's called black carbon. It's the second largest contributor to global climate change after carbon dioxide. On the health side, 3.8 million people die each year from exposure to this indoor air pollution. That's more deaths than HIV, AIDS, malaria, and TB combined. So this is a big problem, and it's kind of an unknown problem sometimes in a lot of spaces. And so people have been trying to address this problem by building clean cook stoves or improved cook stoves, coming up with programs to distribute them, subsidize them, and trying to find out ways to get behavior change, get people to start adopting newer methods of cooking, which have fewer climate and health impacts. But it's not been working that well. There's a lot of challenges with the adoption, and there's been a lot of money put behind this. So at Nexleaf, we're trying to find ways to improve these interventions. And I'll get into that in a minute. First, I'll describe a little bit where Nexleaf came from. When I was in grad school, I was doing computer science, so I was building digital, virtual tools and things. And something clicked in my head, and I really wanted to build physical things. Over the years, that's sort of come up as, trying to build metal furniture, building drones from scratch, all sorts of different things. In grad school, I happened to come to a center, a place called the Center for Embedded Network Sensing, where they made the building of two things meet, both building digital things and building physical things. They were, at this center, I was part of it, were building systems that were taking the physical world and digitizing it. So back then, we called them sensor networks. Now they're called IoT systems. We were particularly targeting scientists, helping seismologists, ecologists, biologists, collect a lot of data to help them do their science and answer the questions that they're posing. So my co-founder and I, we were in the same center. We realized that this technology and this approach to collecting all this data and analyzing it was going to take off and be really successful in wealthy countries. And as Sri's all his examples shown, it is taking off, and it is, it's increasing value, it's optimizing operations. You got all your favorite buzzwords around IoT in there. We saw that in low-income countries, it was going to be a challenge. These types of systems, there's a lot more challenges and a lot more that's needed to get these systems to work, and actually to get the systems to have value and for people to understand the value. And at the same time, we saw that so much money was being spent on various types of interventions where they were just making big assumptions up front, not really using data, doing the intervention, and then doing some monitoring and evaluation afterwards. And so we realized we can take these systems and we could build these systems in ways that collects data and helps empower these interventions to be more responsive and enables an iteration that wasn't possible before. And also brings light to the value of the data and try to create a market and a demand for this data. So back to the cook stoves. So what we've done in the cook stove space is we have a system we call Stove Trace. It's a remote temperature monitoring system. It's an IoT system that tracks the temperature of the stove. So we're tracking how often and how frequently everyone's cooking and making use of this new stove. The traditional way to do these programs was you distribute clean cook stoves, and then you come back in a few months and you ask, hey, how's it going? You do surveying. What usually happens is you get one of two responses. They either say, it's terrible, I'm not using it, or they say, it's great, I love it, I'm using it all the time. Our experience says when they say that second thing, it also means they're not using it. You're just getting the answer you want to hear. And so with this system, we can start having actual, real conversations about the data. When we first a little brief, some data to show that surveying isn't effective. So when we first started out, we compared the actual sensor data, so the amount of time someone spends cooking, to the amount of time they reported cooking. This initial cohort was, because this was one of our first attempts, they were very much, engaged in the process, so they were cooking. They weren't just like not adopting and not using the stoves. But you can see that there's absolutely no correlation between what they reported as cooking and what the sensor said. And so the data lets us have nice, grounded, truthful conversations. when we go and ask the question now, how's it going? And our staff loves doing this part. They come, they ask, how's it going? How can we help? What do you need? Do you like this? Is it working? When they hear the response, it's great, I love it, it's working, they look at the data and they show them, it looks like you're not cooking. Can you explain what's going on? And for the villagers, something changes for them and they realize, oh, you actually care about what I'm doing. Great, I'll tell you what's wrong. I don't like this about the stove, you could improve this, it's breaking. We actually start having those conversations. The data enables that. So on top of that, we can take that data, take that feedback, work with manufacturers. In some cases, we've completely switched stoves. We've been able to do this iteration. And we can do other things as well. And we've iterated to a point where we have a program now where it's basically sensor verified financing. These stoves are anywhere from $30 to $80. And so that's quite expensive. Typically, they're subsidized at the manufacturer, the distributor level. With the sensors collecting this data, we can shift that subsidy down to the individual. What this does is it helps incentivize. So they get a loan to purchase the stove, and as they're cooking, as they're using the stove, there's a payout to them to help them pay it off. This, as I said, is a big incentive. It gives them an asset. They understand that this is an investment, and they have more of a voice now. So we get even more complaints and more feedback about how things are working, and let us further improve these processes in this program. And so this is what it looks like. On the left, you see sort of when we first started out, the green bars indicate the average cooking duration per day. And you can see over time on the improved cook stoves, it dropped off. We iterated, we changed a lot. We really used the data in all those methods I described and more. Some didn't work, some did. And this is where we ended up on the right. We're seeing sustained adoption. So the data really has had an effect when we've applied it and combined it. So we're able to focus on affordability, trying to optimize how the whole system is being used and what the data is being used for to identify where things are not necessary, trying to make the stoves more user-friendly, getting that feedback, but also make the program and how we're interacting user-friendly. An example is where a lot of the funding that comes in, pieces of it go to enabling energy entrepreneurs, so someone that's actually providing after-sales service for these stoves. That wasn't done before, and that's been a really important component. And we're starting to see some behavior change. So the previous slide with that sustained usage, that's a good indication to us. And that desire to provide the feedback and to complain when things aren't working. And the last one, the sustainable markets. So earlier, a few years ago, we were the only ones doing sort of wireless data collection with these stoves. There's some other folks using data loggers, but they were doing just short term. They would only monitor for a day or two, not long term. In January, I was at a workshop, and there are now, it was really amazing to see that there are now 2 other groups using wireless sensors to collect this usage data long term, and then 2 other data logger systems that are also being either taking little snapshots or long term. So that's great. To me, that's like there's a market starting, there's people that are interested in the data. We're also seeing funders have a desire for this data as well. They want to know their investments are working. They want to know these cook stove projects are actually not ending up like that previous slide I showed, where there's no adoption, there's no sustained use. And so that's a really good sign for us. The work and this process we've been putting in is giving other people ideas, and other people can see that there's value in the data. So of course, all of this is running on top of AWS. It's really let us be cost effective and enabled us to do this quick iteration with the technology. So I'm going to switch to the other problem we work on. But first, I want to do a little transition. I mentioned earlier that taking these IoT systems and trying to apply them in countries, in low-income countries, brings a lot of challenges. It's these are just an example of some of them. We've gained the experience to learn how to solve some of these, but we still keep running into these. There's just the infrastructure is a problem, everything's remote. Getting funding and figuring out ways to make people value the data and pay for it is a challenge. So the other area we work in is around vaccines. Vaccines are a great investment. They can save so many lives. However, there's challenges distributing them in low-income countries. Most of them need to be refrigerated. They can't get too hot or they can't freeze, otherwise they lose their potency. And the challenges enhanced becomes larger when you realize that people don't have visibility into the infrastructure, meaning the refrigerators that are deployed around a country in remote health clinics. No one knows if those fridges are working or not. So every year, billions of dollars are spent on vaccines, and up until a few years ago, no one knew if that final destination, that final resting place before the vaccine is dosed out, was actually working and maintaining the safety of that vaccine. A lot of those challenges come down to power. Intermittent power means the fridges can't maintain the cold. There can be just equipment problems. The refrigerator fails, something breaks, and either the staff doesn't know or there's no supply, there's no infrastructure for them to be able to communicate that there's a problem. The technicians can't get the funding to go for the transport to go visit the clinic. There's a lot of challenges in understanding what's wrong and where these problems are happening. And finally, there could be management issues where, it could be someone is, storing additional things in the fridge, they're not cleaning those solar panels, they're not doing the proper daily or, monthly maintenance on the fridge. And so this one we've addressed from the bottom up. We have a system we called Cold Trace. It is another IoT system that also monitors temperature. It tracks the temperature in the refrigerators. At the clinic level, the value we're providing there is SMS alerts. So typically, the nurses and health facility workers have to fill out a paper chart twice a day, recording the temperature manually. We know from our data, similar to that survey plot I showed earlier, that this doesn't happen. They'll fill them out, but it's often backfilled. It's because they don't have the time and they don't have the resources to do that. Now they have the assurance that if there's something wrong with the fridge, they get an SMS. And they have the advocate in the data. The data will back up. They know that the technicians and other people will see the data and understand that, yes, this fridge is having a problem, and yes, they need to go repair it. So we did an RCT in Mozambique, where we had groups split up, some with SMS, some without SMS. The ones with SMS were more responsive. This is an example of the type of data, of the type of work we have to do to promote this data and to promote these types of systems, and to show that there really is value in this data. We've done also total cost of ownership work to show that the value of the vaccines that's saved is greater than the cost of these types of systems. So we can move up the chain, so from the health worker to the district or regional management, whether it's a logistician or a vaccine officer or the technician, they can use the data to optimize their practices. So on the right, they're kind of small, sorry about that, but on the right, we worked with some technicians, also in this case in Mozambique, where we had them look at a number of fridges and said, okay, let's just call these clinics and see if we can get them to remotely, just by talking to them on the phone, get them to fix the issue, the problems that were happening. In this graph, red is hot, blue is cold, green is good. You can see that just after placing, a dozen phone calls, the next week, most of the red and blue was gone. So this is saving a lot of money and a lot of headaches because it's giving them visibility and giving them the ability to communicate about what's going on. So then you can move up to the national level where they can start with these types of systems. They can start asking questions like, am I buying the right types of fridges? Do I need to buy more fridges? Do I have enough technicians? All of these questions can be answered by aggregating and looking at the data. really what the data is enabling is alignment of all the players, from the facility staff all the way to the National Ministry of Health. And it's happening actually beyond that level to the sort of funder global level. UNICEF, WHO, Gavi, Gates Foundation, everyone, this type of data is the, they all want to see this. They all want to know, are the investments in the vaccines and the fridges and the infrastructure working? So the data is really, really serving to align everyone. And so we've been able to get some scale. So in India, we're covering 2/3 of the health facilities, which is really huge. India was the first one to go big. By the end of this year and into next year, we're scaling up in Tanzania as well. And we're doing some scale in Mozambique and Kenya as well. And so what that looks like for us as an organization and our impact, we're very proud of this. So we're covering over 12 million babies each year with the system. And that's about 10% of the babies on Earth. And in the cook stove side, we're on the verge of scaling. We've done a lot of iteration, and at this point, we're ready to take the model we've come up with and continue to try out some iterations, but also to scale. So in the past few years, we've covered over 800 households. We've reimbursed over $6,000, subsidized over $6,000 in these stoves through making use of the sensor data. So as an organization, we're targeting 11 of the UN SDGs, and we're trying to expand. We're looking at agriculture to see whether setting up and monitoring a cold chain for the storage of crops post-harvest actually brings value. No one knows. We think it does, but we will see. The data and these types of systems will let us answer those questions. So that's it. And thank you for listening to me ramble for a bit. And please come talk to me and ask lots of questions. And again, I want to hear how you guys are using data and what you think can be improved through the daily use of data in your interventions.
I think we still have 7 minutes or so time left. So if anyone has any questions, feel free to ask right now. Yep.
Is the cooking devices you're using, are you producing those, or are you just tapping into those?
We go through a process to try to select the best cooking devices that are the most appropriate. So we have a process where we bring in a number of different stoves, and we have them lab tested, and we field test them, and use our method to get feedback to understand what works best. So we don't produce the stoves. There's 4 tiers of stoves, tier 1 through tier 4. We try to only stick to tier 4, which is the most clean and most usable. But in some cases, just because of the way the context is, you have to use a tier 3 to see adoption. So our goal is to get all tier 4 stoves used everywhere, and that's why we're trying to collect this data. Yes?
I know there's large numbers of communities that are not within distance to health centers, so there's community health workers that travel to vaccinate. And I was wondering if you're working or in development or know of anybody that is doing similar work with the transportation devices that they use to make sure that the vaccinations keep the progress there.
Good point. We're about to manufacture. We also, so we're kind of weird as an NGO because we manufacture. So we have a manufacturer in India that we work closely with to build these things we make. And we are just about to manufacture a device for transport. So it's not only the outreach, the last mile, but then there's also from the national store to the regional stores to the district stores to the health center. We want to be able to provide visibility across the whole chain. So yes, it's for the remote areas, it's a little Bluetooth sensor with a bunch of storage. I could tell you about it more. Yes?
What kind of strategies are you using to maintain last mile connectivity from the sensors?
So in the health facilities, there's maybe, and what's odd is we've seen this number validated, well, not validated, but it's all anecdotal. Maybe about 5% of the health facilities don't have connectivity. So in those cases, you could make use of something that is just logs the data and it's downloaded when someone delivers vaccines. So those are a challenge. But you can build Bluetooth loggers or whatever, because most of the folks doing the logistics and delivering the vaccines, they're already using tablets and everything. You don't get the responsiveness, but you still get the feedback, which is the most valuable part.
Any others? Great. Thank you, guys. Thank you, Doctor.